We all know that adults consume these products, don't we? Adults consume these products knowing the impact that they can have on them. There's research being done. They have an informed choice about whether they take these products or not. But how would you feel, or would you, as parents, give alcohol to your child? Baby, we're talking about here. What about opium-based products? Would we give those to infants? What about cocaine-based products? I'm really hoping that's a no from everybody. Our social services are on the phone. Caffeine, full-fat cola. I mean, I still see that. I still see parents giving that to children. We do know that's unhealthy. What about cigarettes? Smoking, would we allow little children to smoke cigarettes? And I'm hoping the answer from 99.9% of you here is a no, because we know how harmful these products are for our children. But what if I told you that actually in the 16th to the 20th century, it was considered normal to give alcohol to babies? You used to put it in milk, it helped them sleep, it helped with teething, helped with pain. So it was a normal thing to do. It was socially acceptable. In the 18th and 19th century, we regularly gave opium-based products to children. You could buy opium-based products over the counter, seen as not problematic whatsoever. When we realized that it was a problem, cocaine-based tooth drops were created. This was seen as a cure-all. It cured the opium addiction that we were seeing in these young children. Let's give them cocaine instead. Good luck with that. But then we realized that was a problem as well. But at the time, it was normal to give cocaine-based tooth drops to children. You could buy them over the counter. And it was only really at the start of the 20th century that cocaine was taken out of Coca-Cola. Normal to give babies Coca-Cola in the 20th century. Even probably now in the 21st century, we will see children drinking this. It is full of caffeine. Caffeine is a drug. It's an addictive drug. And this, unfortunately, in the 20th century, maybe some of your parents, I certainly know my dad was one of these people who, in the 20th century, when he was little, 40s, 50s, 60s, smoking was normal because it was glamorized. The adults in society smoked. It was glamorized. It was seen sexy. It was seen as cool. Nobody knew about the risks of smoking. And at the time, all of these products were considered as safe and effective. So if we look, we've got the 16th century, 17th, 18th, 19th, and 20th. We were giving children products which we now know are unhealthy. I mean, they're unhealthy, at worst, illegal now. So what are we doing in the 21st century? Did we just get it right? So we're no longer doing anything wrong? Have we just nailed this parenting thing? Or is there something that we're doing now that in 100 years' time, someone's going to be doing a talk like this saying, can you believe they did that? So I want to go back to the questions I was asking you. How many of you would think it would be okay to give your child a smart device to play with? I think the answer is that most of us think that's okay because it's normal. As much as giving cocaine and opium and cigarettes to children historically was considered normal and socially acceptable, seeing children on devices is normal. I think we've all been to a restaurant where we've sat and we've seen a child behind a device. I was on holiday recently, went on a whale watching tour. The 4 children sat in front of me, all on devices. Instead of watching this wonderful landscape that we were sailing past, they were just sat on these devices. It's so normal and so commonplace now, but at what cost? And you might be thinking, well, it's a device. They're not consuming it, not ingesting it, not smoking it, inhaling it, swallowing it. But we are still consuming. We're consuming it visually. And it's not just the consumption of the device. It's the impact that the device has on our interaction with the world, and especially that of young children. So what all of these products all have in common, so cigarettes, nicotine, caffeine, cocaine, opium, alcohol, and devices, is that, first of all, it's us, the adults, as parents, that choose to give these devices to the child. The child isn't really asking for it. We're just unleashing it on them. 2, it's considered as normal. And it's effective, isn't it? If you've got a toddler wanting to run around, it's kind of annoying, isn't it? You want to sit down and eat your meal in peace. It's effective. Put them behind a device. That toddler's not talking to you all day. So it works. But the the most important thing is that they all work on the same neurotransmitter systems in the brain. They all work on the same addictive mechanisms. I'm going to talk about the most commonly known neurotransmitter, I think, is dopamine. We hear about dopamine a lot, but dopamine is released to drive our action towards things that we experience as pleasurable. So as much as we can be addicted to cigarettes or alcohol or cocaine, we can be addicted to a device as well. And it's a really clear link between, say, cigarettes or cocaine and the impact on our health. It's obvious, isn't it? We know it now, but it's not as obvious with devices. And as I mentioned, the impact with devices is about how it stops us interacting with the world. Now, let's have a look at the outcomes. So if let's take the past, okay, what happened in these previous centuries to these people who consumed these products in infancy? What happened to them in adulthood? They all struggled with emotional regulation difficulties, neurodevelopmental problems, learning difficulties, memory problems, challenges with attentiveness, hyperactivity, motor development. There were developmental delays as well, certainly with alcohol. There was an impact on physical growth, a weakened immune system, a higher propensity towards addiction and substance use disorders, obesity, cardiovascular disease, chronic pain, and consequently mental health problems. So if that's what's happened historically to people who have been addicted to these substances that work on the same neurotransmitter systems as the brain, what do we think are going to be the outcomes of device use in infancy in years to come? And we don't know. I mean, that's the reality. We don't yet know because we're in the eye of the storm right now. We're in this place where in that early 0 to 4 period, children are using devices, free will, willy-nilly, all the time. And we are seeing the problems, okay? There's a pattern here. They all work on the addictive mechanisms in our brain. And the past helps us to predict the future. So if we look at what happens to people historically, we've got a good idea of what's going to happen to these children in the future. We already have mounting scientific evidence about the impact that devices are having on child development. The evidence is that the younger a child gets a device, the poorer the mental health outcomes in adolescence and adulthood. We've already seen an impact of, this is all scientifically researched and evidence, an impact on physical, cognitive, emotional and behavioural outcomes, speech and language development. And speech and language development is a big one. We've got 20% of children awaiting support for speech and language at the moment. 1.9 million children on waiting lists. And the reason is that when we've got them behind a device, they're not in the room with us. That it's like, I've got a device here, a child's got a device there. They're not present. A child learns through engaging in the real world. They learn through their relationship with their primary caregiver. So if you, the primary caregiver, are behind your device and the child's behind their device, you've got this double pane barrier in between you and that child. A young child learns about the world, how to behave, how to regulate their emotions, how to speak through engaging in these activities with their primary caregivers and those around them. But unfortunately, when we're using devices too much, we are stunting that development. Now, actually, at a the dinner table is a great place for a child to acquire language. They can sit, they listen, they watch how other people do it, they learn about turn taking. So giving the child that opportunity to engage in language is how they acquire that. But at the moment, we've got a big issue with it. Similarly with emotional regulation, children learn to regulate their emotions through being taught. So when you're upset and you're cry, 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 you need your parent or your primary caregiver to come to you and say, oh, what's wrong? You seem really angry. And, help the child. Oh, that is angry. This is what this means. But when we just say, oh, God, that noise, here, have a device. Or we put the device in front of them. We've all done it. Put the device in front of them. But what we're doing is we're teaching them to use something external to soothe their emotions. So instead of helping them to internally regulate their emotions, we're saying, hey, use this external object, which is a device right now. That's going to soothe your emotions. Now, at this age, it's a device, but as they get older, they're always going to be reaching for something external when they feel bad because they can't regulate themselves. Emotional regulation is the bedrock of healthy psychological functioning in adulthood. If we can't regulate our emotions, that's when we struggle. School readiness. 33% of children in the UK are not school ready. So that means they can't go to the bathroom on their own, they can't communicate their basic needs, and their speech and language is not at the level that it should be. Obesity. Now, they're obviously not eating devices, so how is it impacting obesity? Well, there's a fourfold increase in obesity in children since the 90s, and it's doubled in adults. Now, it's multifactorial. There are various reasons. But ultimately, if your child is addicted to a device, which is what happens in our brain when we use a screen too much, they are going to favour time sat behind a screen than they are getting up and moving around. If they're not moving around, it's going to have an impact on the amount of calories that they burn. I mean, I work with quite a lot of schools, and I've found that children are starting school, or I've certainly been told that children are starting school and able to put their arms above their heads, unable to run around. Stamina is an issue. I was told by a school recently that they had a child who couldn't sit up on the chair because their core strength had not developed enough because they spent so much time slouched behind a sofa watching the screen. So we see musculoskeletal problems as well. But teachers regularly comment on stamina now. So they'll say that children don't have stamina. That never used to be a problem. So a child's fine and gross motor movement evolve through running around and engaging in the world. And that is a lot for a parent, isn't it? But we need to allow them that space to do that. Naturally, our sleep is affected by using devices, especially with teenagers. They'll tell you that they're on their screens till really late at night, and they don't sleep, they don't get the depth of sleep, they don't get the quality of sleep, and then that has an impact on their mood, their attentiveness the next day, and it goes on and on. It's a vicious cycle. And look, ultimately, if all of these factors aren't sorted out, your mental health is going to suffer as well. If we're not engaging in the real world, we're not doing activities that we fail at, we're not going to develop resilience. If we don't do activities that we succeed at, like our sports or our hobbies, then we're not going to develop self-esteem, self-confidence. And that's what's happening with the teenage generation especially. Atypical sensory processing. There's an evidence here between ADHD and device use and the development of autism. Now, dopamine is the main neurotransmitter involved in ADHD. If we're using our devices, which is encouraging the release of dopamine in the brain, it's not a surprise that it's hard for us to pay attention on anything else because we're looking for the dopamine hit the whole time. So what do we think we're going to see with future generations? Well, if that's what we're seeing now, it's not going to be good for the future, is it? We're going to have a grown-up adult population in 15 years with emotional regulation problems, challenges with attentiveness. We're seeing this already. Impaired interpersonal skills, poor emotional development, physical health problems, musculoskeletal issues, impaired creativity. If you don't have to think, if everything's given to you, like through scrolling social media, it's all passive, isn't it? It's all passive engagement. We're not thinking. We're not learning to think for ourselves. We're not developing those critical thinking skills. And this is all going to result in us being much more socially isolated. And again, it will have a really negative impact on our mental health. As a species, we haven't evolved to a point where we can just live through devices. We need much more interaction with the world, with other humans, with nature in order to survive. In a nutshell, too much device use is going to result in a public health crisis. We're already getting there. In 10 to 15 years, it is going to be much worse. So my advice is delay the introduction of a device into the child's life for as long as possible. When you do introduce it, gradually introduce it. Much like we do in the real world, we don't just kick our 4-year-old out and go, hey, find yourself the way to school and bring the shopping home. We actually gradually introduce them. So we need to do that with the online world as well. What are the risks? What are the obvious risks? And what are the not so obvious risks? We need to introduce them to that and teach them. But we also need to learn that as well. We're the problem. I mean, we're all really bad with our devices, aren't we? We need to model healthy device use behaviours. When we normalize that, that will just become normal for your child. No devices at the dinner table is a good place to start. Easy one. Communicate, talk to each other, find out about each other's day. No devices in the bedroom. Charge all your devices downstairs. The research has found that even just having a phone in the room, even if it's in a drawer, will have an impact on your sleep. Create some device-free zones at home. So that can be a period of time, or so between 6 and 8 we don't use devices, or it could be a space. So it might be a certain room where you don't allow phones in. But just start thinking about it. What works for you as a family? Ultimately, putting these boundaries in is where we need to start. These devices are integrated into our lives. Children are going to be using these as they get older. So we need to teach them how to healthily and safely use them and integrate them into their worlds. And just one final thought. These three guys, all very successful in their field, billionaires. But the one thing that they all have in common is that they don't let their own children use devices. They know the risks, they created them, they created these apps, but they don't allow their own children near them. They're very strict. So if they're not letting their children on them, why on earth are we letting our children anywhere near them? Thank you.